Thank you, Mayor Lane. Thank you to everyone here that has come today to support Scottsdale in its growth. And we're so excited to be in Scottsdale, and we have been here since our beginning in 2002. So Globalmed is a company in Scottsdale at the Scottsdale Quarter, right across the street, formerly called the Air Park, for where we're located. We have been focused on the same issue, but in a broader range than what Andrew has just shared with us. We've been focused on the capacity issue and also the access to care issue. And we've been doing that since about 2004, where we realized that people needed to be seen instantly by docs when they are in remote locations. And so we've created a suite. We worked with a lot of different providers of video conferencing systems, and we literally designed systems that allowed for that capacity issue and that access issue to be addressed instantly. And I'll share a little bit of how we've done that. One of the main issues is the capacity. Today in the United States, we have about 390 people per physician. But in other parts of the world, that is as high as 50,000 individuals to one physician. The other day, I heard a story in Malawi, which is one of those countries that has such a terrible, disparate relationship between docs and patients, 1 to 50,000. If you get sick in Malawi, you either wait for the physician or the nurse to come to your village once every 4 weeks. If you're too sick and you cannot wait, how you seek care is not via an ambulance, not via a car, but someone you love straps you on their back and carries you to the next village where the caregiver may be. Now that is a challenge. And so here in the U.S., what we have done is we have created technologies that go in the clinics, they go in workplaces, they're used by our government, by the VA and the DOD. And these systems literally have all of the diagnostic equipment attached to them, and that equipment, then the data is shared in one seamless workflow. So an EEG, an EKG, the vital signs, the video, the imaging, all comes together in one simple platform where the specialist located somewhere else can see that patient and render care at that urgent care, at that emergency room, at that clinic. Now, in doing so, we've literally have put somewhere in the neighborhood of about 5,000 systems in around the world. And we are seeing on average in the last year, I think about 3.5 million patients. We don't provide the doctors, we provide the technology and the empowerment to the physicians, to the healthcare providers. Some of our customer base, as I shared, we're in the VA, and we're in every location of the VA. 150 some hospitals, 850 community-based outpatient centers, where vets do not have to travel to go see their doctor. They can go to their local clinic, a 1,500 square foot clinic that they can actually go to and be seen live, and their data aggregated into where the physician is. And even our Undersecretary, Dr. David Shulkin, the head of the VHA, sees patients when he's not administrating the VHA, and he actually sees patients 2 times a week from his office, and I think he sees them in very disparate locations across the U.S. The White House is probably one of my most favorite from the aspect of the access that I've been granted and my team's been granted to provide the systems that are on Air Force One, to provide the systems that are at the White House, at Camp David. Next week, again, I'll be up at Camp David and helping to educate the medical staff there for when the president or his staff are in Camp David, they literally will have care that is connected to some of the best physicians around the world. Here in town, Maricopa Integrated Health, Banner Health, Honor Health, and others, Mayo, uses our technologies to where they are able to see patients in other locations around the state. around the world in Petrobras oil companies. So if you imagine you're on an oil rig, you're 400 kilometers offshore, kind of hard to get care, very expensive to transport. Our systems are there tied to physicians, rendering care instantly, and then proper decisions can be made whether or not to evacuate. Another one is in California. The entire correctional system uses Globalmed technology so that the patients or inmates do not have to be transported off-site when not needed. In fact, in California, they've got a new way of doing it where they actually don't even bring the inmate out of their cell down to the infirmary because of all the challenges that happen when they do that. They actually roll a system right to the cell. And this has increased such safety for others that it has been extremely successful, and other states are looking at replicating what they're doing in California. This is a map of our locations. We're actually in 60 countries, 6 continents. We have about 70 different distributors that are educated on how to deliver the technology and integrate the data into one seamless platform. We have 2 offices, one here in Scottsdale, and our second office is in Côte d'Ivoire on the Ivory Coast of Africa, and I'll share a little bit of why that is in a moment. Traditionally, hardware, the devices, need to come together to the software, and so we have created a software suite in Scottsdale that talks to all these different manufacturers and then places it in a very seamless workflow, very easy workflow. And that software right now, I think, is in the hands of somewhere in the neighborhood of about 10 to 20,000 different physicians, and somewhere in the neighborhood of 3,000, 5,000 locations. We've also taken the heavy systems that we have and we've reduced them to the iPhone. And so that you can, a soldier, a veteran can be in their home, they can get care. A doctor can use their iPhone, can use their smart device to get the data, can see the patient live at any point in time. So we've been rounding out our software platform. But one of the big challenges that we've seen is we always see patients, our systems see patients when it's in a dire need, when they truly are needed for acute or episodic care. So we have changed a little bit of our focus, really going after well-being. Well-being, you'll hear more and more about it in the future. Presenteeism in your workforce, in your workplace, you may notice that certain folks in your operation, you may possibly yourself, you're not operating at 100%. And often that is from depression or from hypertension, pre-diabetes, and so we're developing a whole side of apps that will help in the wellness side as well to get everyone to handle their care personally. We've rounded out our solutions. I'm running out of time. I'm Red here, and I'm going to go on to my colleague, Dr. Lynn.